Hello, everyone, and welcome back to Big Impact Louisiana. I'm Sherrard, here with Prevent Child Abuse Louisiana, a vital program of Link dedicated to supporting families across our state. Prevent Child Abuse provides 24/7 emotional support, parenting resources, and education, including the parent line accessible via call or text, alongside training programs for ACE, darkness to light, bullying awareness, and more. I'm so excited that one of our own from Link, the wonderful Miss Sherrard Crespo, is here with us today to talk about some of her work, specifically with Prevent Child Abuse Louisiana, as well as some of her leadership style of being also the Vice President of External Affairs at Link, not only as well as the CEO Director of the Prevent Child Abuse Louisiana. So she wears many hats around here. How are you doing today, Sharon?
I am great. Thank you so much for having me.
I'm glad you were able to come on. So let's get straight into it. So my first question for you is, can you tell us about Prevent Child Abuse Louisiana, just more about the mission, some of the core services and the community you specifically serve?
Sure. So I can give a little bit of background on Prevent
Okay.
Child Abuse Louisiana. So Prevent Child Abuse Louisiana is our state's chapter of Prevent Child Abuse America. We are officially chartered as the Louisiana state chapter of Prevent Child Abuse America. Formerly, for those who were familiar with Prevent Child Abuse Louisiana, or PCAL as we normally call it, it was a standalone office that unfortunately did have to close its doors in 2019. We have been answering the parenting, emotional support, and crisis line for the standalone office, since that is what we do so wonderfully at ViaLink. Um, when the office did have to close, they were generous enough to give us their rollover funding so that we could keep answering that support line, which at the time was called Kid Line. Um, as time went on and we were no longer had a state chapter in Louisiana, Prevent Child Abuse America, of course, they didn't want us answering their phone line because we weren't affiliated. But we thought providing that specific marketed to parents, that safe space for parents was really important. And then COVID hit and parenting got even more stressful. So we
Right.
decided to roll what was Kid Line into now our Louisiana parent line that you mentioned, Shercole.
Mhm.
And we were really able to boost the numbers and access of parents being able to get to this emotional support, anonymous, confidential emotional support, especially again through COVID, which was made parenting even more stressful. So as that grew, we were approached with the idea of bringing back PCAL, Prevent Child Abuse Louisiana, and umbrelling it under ViaLink. So we went through a pretty extensive RFP process, which we did get granted, and then we had a provisional chapter. And then last spring in 2024, we officially got our official charter to be Prevent Child Abuse Louisiana. Yay! It was very exciting. So with Prevent Child Abuse Louisiana, we do have a mission of providing 24/7 emotional support to families, connection to parenting resources, advocacy for children and families, and educational training for those who care for Louisiana's children. So we try to accomplish that through Louisiana Parent Line, which is available by dialing 833 LA Child or texting 225-424-1533. That's available 24 hours a day, free to use, confidential, and that is connection to parenting resources with a live resource specialist and also emotional support. That safe space for parents to get the gunk out and say the stressful stuff about parenting that it feels sometimes socially we don't always have the permission to
Mm.
say, with really
Right.
trying to provide an upstream approach to preventing family crisis from those really stress point activators that can occur when you may not be able to have access to resources and just that emotional outlet that we just need as human beings. We have been able to hire a director of advocacy, Erin Sims, which has been wonderful. She's been able to be our voice at the Capitol. We've been able to now join the Children's Cabinet Advisory Board, the Human Trafficking Prevention Commission Board, and also the Grandparents Raising Grandchildren Board as the PCAL seat. And we have been able to really create an extensive list of educational trainings focused on youth mental health, youth suicide prevention, understanding adverse childhood experiences, understanding trauma, then some trainings even developed specifically for school settings like bullying awareness and creating self regulating classrooms. We're really trying to be the connection for parenting resources and all of these wonderful programs that are supporting families. We've always considered ourselves at ViaLink a resource hub, so that just extends itself so well with Prevent Child Abuse Louisiana, and then funding our niche in that direct service delivery with the educational trainings that we have from our clinical staff.
That's great. That is one. You actually answered a few of my questions. So I'll go piggyback off with so about those specialized trainings. So exactly how do you decide and choose how you're what areas you're going to focus on in an area?
I think that it comes a lot kind of two ways. One in being what's the need? What are we hearing about? What are we seeing as trends for training topics that people want? A lot of the times it happens that someone just emails us and says, "Do you provide a training on this?" That's how the
Mm,
bullying awareness training came up. And it was like, well, not yet, but we can create it. Which is really wonderful to have that space, I think, especially for our clinical staff to kind of get that creativity and keep our
mm,
clinical juices flowing to be able to research and create trainings on best practice. Um, Looking at like trends with people wanted ACEs and adverse childhood experiences trainings, which is a really amazing topic. And we have a really great ACEs educator program in Louisiana. That was also suggested by the national office that we get ACEs educators on staff. So I was able to get trained as an ACE educator, as was our outreach coordinator, Tammy DeBartolo, to provide that. The same with Darkness to Light, which is child sexual abuse prevention training. Um, I know for me, like my clinical expertise is always aligned with suicide prevention and trauma. That's what my direct practice has been in, and just where my kind of passion lies. So, creating those specific topics on training and suicide for our younger people to kind of decrease the barriers and decrease the stigma for parents, caregivers, school faculty, anybody that might have, an effect on a child's life, to be able to make it that they can come to you with these struggles and you'll feel prepared to at least be able to respond with empathy
mhm.
instead of fear. And that's really what our trainings focus on.
That's great. To go back just a moment, just in case for some people who may not know what it means, what exactly does ACE stand for?
So ACE stands for Adverse Childhood Experiences. The training is about the ACE study, which was a public health study originally conducted in the 1990s by Dr. Robert Onda and Dr. Vincent Felitti. Actually, a public health study. They were originally researching obesity with the Kaiser Permanente Health Group, which then led to them discovering these kind of odd groupings and communities of early death. So they decided to pivot their research to looking into why is this early death happening with no kind of like genetic
Mhm,
commonalities. And that was how they were able to actually see that down the road there can be just these directly connected adverse health outcomes from experiencing adversity early in childhood. And so then really digging into the research and studies on how we hold trauma, or maybe even something that wasn't traumatic but was adverse, in our bodies, in our memories, and how that affects our ability to cope. So that's really what our ACEs training focuses on, is understanding what ACEs are,
mhm,
understanding it's not diagnostic and it doesn't predetermine anything, but this helps you to understand why coping mechanisms that might not be as good for us or as healthy for our minds and our body are not as easy to just switch.
mhm.
Um, it's not just negative behavior. It's not just not caring. It's that this is coping that I developed that makes me feel like I can survive, literally.
Right.
And to kind of help everybody to gain some more patience and some more empathy as we may be helping somebody to pivot the way that they cope.
Hmm. Thank you. Thank you. So one of my next questions is with the Louisiana Parent Line and also just with the trainings overall, how have you seen some of the impact on families throughout the state so far and the great things that y'all been doing?
I think that it provides a safe space to be able to reach out for help, be able to really say that parenting is hard, parenting is stressful, and that there's no shame in looking for support. I think there should only be pride in looking for support. I think that though there are so many amazing helplines and crisis lines that we have the privilege to answer at Via Link, like 988, that having a line that is specifically marketed to parents creates a little bit of a safer space for dialogue because I
Mhm.
think there can be some hesitancy as a parent to reach out for help and support, in particular, if that includes a mental health struggle, because you fear judgment or if someone's going to think that makes you a bad parent. And that really saying, like, one of the taglines we have for Parent Line is that life's not always picture perfect.
Mhm.
And so to be able to say, this is the safe space to come with what's really affecting you. I think it's allowed for a lot more momentum towards upstream approaches. We've been really seeing that so much. I mean, just the research shows it that going upstream and providing concrete supports for families is what prevents child abuse,
Mhm.
because child abuse doesn't happen because parents don't love their children. Parents love their children. Crisis moments happen and we can't think and
Mhm.
we're in fight or flight. And that's what happens. And um, being able to prevent these crisis moments for families by having a safe space and then having all of the resources kind of in one space instead of having to go all around, I think really is a
Important.
benefit to our families.
That's very important. Yeah, being able to have everything in one spot to be able to get what you need. I do
Mhm.
appreciate that. I also appreciate your enthusiasm about the programming. That is very important, and I just think that's great. Moving more into like the business and data side of things. So, what are some of the things that you're doing? How are you measuring the effectiveness of your program, of the services? And are you currently using any types of data sets, currently?
So we have a few different ways that we're measuring data.
Hmm.
One is through Louisiana Parent Line. We have our internal data that
Hmm.
we have from where we can capture the documentation, the information from our calls that do come in. That is extremely confidential. No identifying information is ever released, but I internally, because I have signed all the confidentiality papers, can have information to look at what are the calls, topics that are coming in, what are the concerns, what are the needs, and then we do also publish our aggregate data from Parent Line to our PCAL website, which is preventchildabuselouisiana.org. You can look at the stats on where the calls are coming from, and what the call volume is. So we're able to measure just our effectiveness with spreading awareness on Louisiana Parent Line that way. Then we also do have an outreach report that we upkeep. That has how many events are we attending, also how many mail outs or deliveries do we do for agencies or schools about Louisiana Parent Line. And then also when we provide trainings, we do feedback forms afterwards,
Oh,
so
that's great.
being
Yeah,
able
just
to
talking
get
about
that
that.
real qualitative
Mm-hmm.
information on it. Is this helpful, what we're providing for you?
Hmm.
Is this what you were looking for? And side note, when we do provide trainings, we are able to provide counseling and social work CE credits as well.
No, that's great. That's great. So, is there any data you wish you could collect, or is there any data analysis that you wish you had time to dive deeper into, or you would like somebody on your team to just eventually dive deeper into?
I think that I would love to be able to have some real data about if someone has heard of the line, what might stop you from reaching out to it? We have
That's a
kind of
good one.
ideas and kind of these higher level data metrics about that, but really being able to hear from our Louisiana communities, like, what's the best way I can ensure that you feel safe to use this?
Hmm. Oh, that's a good one. I like that one. We need to talk about this off air. Um, so outside of this, I just want y'all all to know that Sherrod wears like 75 million hats here at Via Link. Not only does she run this great program for Prevent Child Abuse Louisiana, she's also the vice president of external affairs here. Her team does so many amazing things around the state. She also has a podcast, Real Talk, where they're giving you actually just like that real talk about mental health and other topics. And she's just been doing a great job, and she's been building a great team. And I just would like you to explain and share how would you describe what's your leadership philosophy and pretty much like your approach to building a team, and as well as your relationships that you've been building across Louisiana.
Sure. And side note, we just had an amazing episode of Real Talk with Cole. So everybody should check that out. I think with leadership for me is like I'm not good at like micromanaging. Like, I don't really want to have to do that for anybody. I want you to feel a lot of passion for your position, and for me to kind of give you general, like, here's the idea, here's something we want to work on, and you be able to run with it.
Mm-hmm.
There's of course things of like, hey, I need you to document this way or do that way. But I really, with my team, and they're great, try to have a lot of freedom into like, this is where your passion area lies, this is where your
Mm-hmm.
connections lies. So here's, you go with this. Because I think, as you mentioned, Shercole, with wearing a lot of hats, we work for a nonprofit. All of us wear
Right.
so many hats. And we have the ability to do that because we care so much about what we're
Mm-hmm.
doing. I know for me, our CEO, Lavandra, always been her management style with me is like, yeah, there's some stuff you have to do, but you find those passion projects too, and I'm going to let you run with them. And I really try to do that with my team to make sure that we always have a balance of just being on fire for what we're doing
Mm-hmm.
and feeling really energized by it. So I would say that's my leadership style. I make myself really available to check in with. We definitely have some venting sessions every now and then when that's the case. I really try to just make us feel like we are a team, not that like I am your supervisor type of
Right.
thing, and that we just kind of all try to keep in the loop, checking in on each other, all on the same page, and yeah, just letting people find where their kind of specialty interest lies.
Mm-hmm. Also, one thing I think you do really great is building relationships with organizations around the state. And that's a area that is really hard for a lot of people, especially smaller nonprofits. Do you have any tips to help people get to a place where they feel more comfortable in getting at least the first and second steps to actually building those strong relationships they need as they move across the state in the different areas that they might be trying to get more into or get more information about or actually be able to collaborate with other programs?
Yeah, I think that it just really takes putting yourself out there and sometimes stepping out of your comfort zone a little bit, like not being afraid to just kind of cold email someone or being sure, I think for us, when we were kind of developing the outreach program years ago, it really started at first with like, well, let me just attend like every bigger kind of like health fair that we have. Cause then you have
Mhm.
so many agencies there that you can start meeting with and networking with. And then just really knowing how to highlight your agency and what it does and make that connection with whoever you're meeting with. Like if I was meeting with, you know, in a meeting with adult protective services, because I have one of those
Mhm.
coming. It's like I'm not gonna really like highlight what trainings we do for children because that's not gonna
Right.
connect with them as much. But we might talk about mandated reporter trainings and things like that. So really knowing your agency inside and out and being able to talk about it like a person, not like you're reading off of cue
Mhm.
cards is really helpful. And then just staying engaged. I mean, going to every meeting that you can, being sure that when you are at maybe coalition meetings and things like that, that you're always giving an update and sharing about your agency so that people start to really have that kind of like brand recognition and know that, oh, y'all
Mhm.
are always up to something. Like, let me check in
Right.
with y'all. Um, and yeah, I think just also being sure to celebrate what the other agencies are doing. There's so much amazing work that goes on, and trying to make sure that we stay out of competition with each other and rather are all elevating each other. The
Mhm.
rising tide lifts all ships. I think that attitude is really important for outreach and for connection, because we can't have connection if we're competing.
I
So
agree.
really being sure that you're referring people to other agencies when they think about it, connecting people via email. I'm saying email a lot because I don't like getting calls in the middle of the day unless it was
Me either.
scheduled. So, like, just knowing what works best and just really making yourself available to others. Like, I really take a lot of like pride in that I answer emails really quickly and get back to people really quickly. So, just making sure that people know that you're engaged with them.
Hmm. I think those are great steps and some helpful tips for, our listeners. So my last question, specifically about leadership is, what do you find to be one of the most important leadership qualities needed to guide a program, especially in times of crisis? And we live in Louisiana, you never know when a crisis is gonna pop up. So what do you feel is one of the most important qualities needed to lead?
I think that you have to be confident but not arrogant. Um,
Mm,
I think that you want to display confidence because you want your team to have faith in you, but you never want to come off like, well, I know better because I just happen to be, the program leader or whatever this might be. Especially when it is times of crisis, like being able to kind of take a breath and just let everybody know what needs to be done is really important. I think that's where that confidence comes in. And then making sure that you're checking in with your team, that you're remembering that they're people too, that might be stressed by what's going on. So making sure you have the time for debrief, making sure you have the time for check-ins. Is really important. I think feedback I get from my team a lot is that they like positive to me is that they like that I'm always available
Mhm.
when they have a concern or a question. They know that, if they need a mental health break, they just let me know they're going to get it. So,
Mhm.
um, yeah, I think always being approachable, but have that confidence to show your team that, like, we got this. And I think that's really important too.
No, that is important. So, what are your key goals for Prevent Child Abuse Louisiana, in the upcoming months and the rest of the year? Any upcoming initiatives or growth plans or anything?
So I think that we just really want to keep spreading awareness that
Mhm.
PCAL is back and does exist. Really letting people know that this is a great space as like your connection for resources, like that resource hub. Um, being sure that people are, letting us know about their resources so we can have it in our resource database and making sure that people understand what Louisiana Parent Line is for. I think sometimes it can get misconstrued like it's
Mhm.
a reporting line for a suspicion of child abuse and neglect, and it is not.
Mhm.
So that's a lot of our focus areas as far as kind of like marketing. And then we're really trying to gear up for next April. April is Child Abuse Prevention Month. Last year, or this past year, gosh, it's June.
I know.
We were able to host our first ever pinwheel walk for Child Abuse
Very
Prevention
beautiful,
Month.
everyone.
Thank you. Sir Cole was an amazing help. And, the blue pinwheels are the sign of hope for child abuse prevention. And so I would really love for us to keep expanding upon that event and really being able to have kind of a leadership position in the efforts for Child Abuse Prevention Month, because I want everybody to be showcasing their programs and spreading awareness and just making sure that we can have sort of a unified front in that so that everybody is getting their space to shine during that month.
Mm, I thank you. One of my last questions for real this time, is exactly how would you like community members, nonprofits, everyone, what is the best way for us all to support you right now?
I think the best way to support us is to just let people know about us.
Hmm.
Again, you can find so much information on our program on our website, which is preventchildabusela.org. Let people know about Louisiana Parent Line, 833 LA Child, and then reach out to me. My email is screspo@vialink.org. We can send you swag. We've got Louisiana Parent Line cards. We've got cool wristbands like what I'm wearing now, things like that that you can give out to your clients, your parents, whomever it is that you're working with, to just kind of help us have a ripple effect of awareness. Because um, that's really what it takes. People go to the
Hmm.
spaces where they're comfortable, so I don't want someone to have to come out of their comfort zone to me. I want to be able to meet you where you're at.
I agree. Well, thank you so much for taking time out of your schedule to meet with us today. I really appreciate you. I will also be putting the website in the description for everyone so you can easily get to the website so you can learn more about Prevent Child Abuse Louisiana and also all of the great work that Sherrod is doing. Also with her podcast, Real Talk as well. Thank you so much for coming on today. I really appreciate you.
Thanks, Nicole.